Today, on the Trioxate channel we are going to talk about Coflix, diphenhydramine hydrochloride, an antihistamine, anticholinergic with sedative effects. Antihistamines appear to compete with histamines for cell receptor sites and affect them. I humbly ask you to subscribe to our channel, share, and leave a like. I ask for your suggestion for the next video. Composition: each 5 ml contains diphenhydramine hydrochloride BP 14.08 mg, ammonium chloride BP 138.00 mg, sodium citrate BP 57.03 mg, menthol USP 0.90 mg, containers, flavorings, and excipients. Description: diphenhydramine hydrochloride is an antihistamine having the following chemical name 2-diphenylmethox, N-dimethylethylamine hydrochloride. Its empirical formula is as follows. C17H21NO.HCl, white, crystalline powder, soluble in water and alcohol and has a molecular weight of 291.82. Mechanism of action: diphenhydramine hydrochloride is an antihistamine, anticholinergic with sedative effects. Antihistamines appear to compete with histamines for cell receptor sites and affect them. Pharmacokinetics: diphenhydramine hydrochloride is well absorbed from the gastrointestinal tract and distributed throughout the entire body including the CNS. The medicine is excreted unchanged through urine, while the rest is metabolized via the liver. Therapeutic indications: diphenhydramine hydrochloride is an antihistamine used for the treatment of allergic diseases such as hay fever, allergic rhinitis, urticaria, angioedema, atopic dermatitis, contact dermatitis, gastrointestinal allergy, pruritus, physical allergies, injection site reactions, reactions of therapeutic preparations, and allergic reactions from transfusions. Symptomatic relief of perennial and seasonal allergic rhinitis, vasomotor rhinitis and allergic conjunctivitis from transfusions. Symptomatic relief of perennial to seasonal allergic rhinitis, vasomotor rhinitis and allergic conjunctivitis relief. Temporary runny nose and sneezing caused by colds, ammonium chloride acts as an expectorant. Its expectorant action should be the imitate action on bronchial mucous membrane. This causes excess fluid in the respiratory tract which presumably becomes easier to cough. Dosage and method of administration: children under 2 years, consult your doctor or pharmacist. Children over 2 years old, 1 teaspoon, 5 milliliters, every 4 hours. Adults, 2 teaspoons, 10 milliliters, every 4 hours. Shake before use. Contraindications: hypersensitivity to any of the components of this compound. Undesirable effects: CNS depression, dizziness, dry mouth, gastrointestinal disorders. Other effects include headaches, psychomotor disturbance, visual and urinary retention, etc. Drug interactions: diphenhydramine hydrochloride has an addictive effect with alcohol and other GNS antidepressant medications, hypnotics, sedatives, tranquilizers, etc. Monoamine oxidase inhibitors prolong and intensify the anticholinergic, drying, effect of histamines. Precautions: diphenhydramine is considered unsafe in porturic patients. It should be used with caution during pregnancy. There have been cases. Repetitos of extrapyramidal dystonic reactions. Storage: store in a cool and dry place. Protect against direct sunlight. Presentation: box containing 100 ml glass bottle. I humbly ask you to subscribe to our channel, share, and leave a like. I ask for your suggestion for the next video.